Oh, okay, welcome to another installment of Extending Health Span. We're getting into the topic of stress, one of my biggest challenges. And I'm going to talk about the benefits of acute versus chronic stress. So the types of stress, the stress hormones, the effects on health, good and bad, and how to manage stress. There's two forms of stress. You have to think of it in this term. Not all stress is bad. Activation of acute stress is activating your sympathetic nervous system that's protecting you to make your choice of either fight or flight. So norepinephrine is released. It allows you to respond immediately to a life-threatening situation. Chronic stress, on the other hand, can be due to a couple things. It could be due to a low blood sugar, like hypoglycemia, or it can be due to worry. In both situations of those episodes of chronic stress, the hormone cortisol is released. It's a slower acting hormone, but it actually increases your blood glucose levels. So when you worry, your glucose levels are increased, just as if you were hypoglycemic. So think of acute stress as an activation intended to save your life. It demands quick action, and both your sympathetic nervous system and your endocrine system get involved. Chronic stress is the one where the hormone cortisol is being released. And in two situations, the natural body imbalance with low blood sugar and the unnatural body imbalance, that's what I call it, unnatural, is where we have constant worry. Both of them result in an elevation of your blood sugar levels. And remember, an elevated blood sugar level, sustained elevated blood sugar, causes inflammatory response through the cells in your body and leads to chronic diseases, hypertension, diabetes, of course. Okay, so looking on the situation or the endocrine side of the chronic stress, the hypothalamus releases corticotropin releasing hormone, ACTH, which then sends that hormone to the adrenal cortex and releases the hormone cortisol. And the result is elevated blood sugar. So this is the physiology of cortisol production. Now there's a medical condition with sustained elevated cortisol. It's called Cushing syndrome. It's excess cortisol, and it used to be seen much more commonly when the steroid prednisone was pretty much the only treatment for chronic asthma, eczema, some other things before some of the newer medications came out. You can also see it with adrenal tumors that secrete cortisol. And patients get these characteristic body changes where they get the buffalo hump on the back of the neck. They get abnormal weight gain and stretch marks because the weight's so fast, easy bruising. Notice muscle wasting also. So if you're trying to gain muscle, addressing your acute versus chronic stress situation is important because that chronic cortisol is negating muscle development. So this is an example of a woman before she developed Cushing syndrome. And on the right, this is a result of having excess cortisol. Fat deposition, brittle bones. Patients that are on prednisone for long periods of time can get avascular necrosis of the hip, and that requires a hip replacement. And then, of course, impaired glucose intolerance and development of diabetes, and of course, the chronic inflammation of having elevated cortisol and elevated blood sugar causes hypertension, heart disease, dementia, just to name a few. So in a situation where you're constantly worried and you're having these persistent elevated cortisol, your digestion actually slows. The blood sugar rises, the body fat stores go up. You start having problems with sleep deprivation. So this chronic cycle, heart rate goes up and your immune system weakens with chronic worry and persistent elevated cortisol. It causes a temporary type 2 diabetes, insulin resistance, leptin resistance. So you feel hungry more, decreases your metabolic rate, increases food intake. And all of those things lead to increasing abnormal areas of adipose deposition. So this is what stress and the obesity cycle looks like. The chronic worry makes behavioral, endocrine, immune changes, increases body fat, and then that cycle just continues. So worry is a maladaptive stress response. So temporary worry is fine. You get over it, you're over things, but this chronic worry is the problem. And what I want to talk about some different ways how we can manage. So to compare it, acute stress comes down from the hypothalamus as well. It actually affects the adrenal medulla. That's the inside of the adrenal glands. And that's where epinephrine and norepinephrine is stored. And acute stress actually decreases food intake. Contrast that to this chronic or worry state where increased cortisol increases sugar and fat intake, increases abdominal obesity, the worst place you want fat deposition, increases insulin resistance. And so here you start ending up in this cycle right here at the bottom with insulin resistance, cortisol, abdominal obesity. Stress has an interesting effect on the immune system. The acute stress actually improves the immune response. Epinephrine and norepinephrine actually stimulate red white blood cell response to infection. It increases antibody production, so you have a better response to developing antibodies. Chronic stress, in contrast, reduces the immune system. Cortisol increases with worry, fewer antibodies are produced, and the development is systemic inflammation. So Eleanor Roosevelt, not being an anatomist or physiologist, came up with one important thing: do one thing every day that scares you. And that might not be something that's life-threatening, but things that scare a person could be talking to someone you don't know, getting up in front of the class, or asking a question out loud. Just a little bit of something that gets your heart racing, just for a moment. Question: can acute stress turn into chronic stress? Answers: yes, never, or it depends. Sometimes those boundaries aren't clear. And that's what I would say. It depends. So I'm going to talk about the story of two arrows. It's kind of a Zen philosophy. So acute stress is your first arrow, and chronic stress or worry is your second arrow. This is the example. Your first arrow happens when someone yells at you and you feel acutely stressed. You release epinephrine, your heart's racing. The second arrow is when you start worrying about it, constantly reliving the episode in your mind. Let's do a case scenario. A vacation in Spain, you're running in the running of the bulls. What hormone is being released as you run down the streets of Madrid? And the answer is epinephrine. So you have this unfortunate event with the running of the bulls, a collision with a bullhorn. You have a wild ambulance ride. In the hospital, you start feeling shame, embarrassment, regret with your decision to participate in the running of the bulls. So now, what hormone is being released as you're stuck in a hospital in Spain? The answer is cortisol. So the first arrow is your traumatic event, acute stress, initial adrenaline rush, or the initial pain. And you get that sympathetic nervous system response. The second arrow is the one caused by grief, remorse, worry. This is what we call suffering. So pain is inevitable. Suffering is optional. Love this quote. Love, love, love this quote. Hard to take it into practice, though. So what approach has been proven to prevent our suffering? Do you get angry and blow off steam? Do you cry to relieve the tension? Or C, meditation? The answer is meditation. Actually, these other options have not been shown to be actually beneficial. So let's look at some scientific studies to show how meditation and mindfulness training actually changes the physiology of the brain. All right, so we have to go to some anatomy and physiology to understand this. Your emotional center, your learning center, and your behavior center are all linked. This is a sagittal view looking at the brain. And here in the middle, in the mammalian brain, by the way, is the amygdala. And these are your emotional centers. Happy, sad, angry, all of that, emotional center. And they're directly linked to the hippocampus. And the hippocampus is your learning center. So this is looking like you're learning how to behave, because your behavior is here. The behavior center is your prefrontal cortex. It's the area of your brain for self-control, for empathy, and not only for yourself, but for others. Let's look at some research. And this was a small group, of course, but still interesting. They took 4 university students and they put them through 40 days of mindfulness training. And these are a group of students who have never done this before. They did functional MRI scans or brain scans to look about how their brain reacted prior to training and upon completion. And then they also did some questionnaires. So these are the methods. Patients watched images with emotionally charged content. And then they observed their amygdala on MRI. So this is their amygdala, their emotional center of their brain, lighting up, sparking. And the results showed that before they had their training, their amygdala lit up a lot more. It was, in essence, more irritable, more responsive. After meditation training, the amygdala was less irritable when they watched emotionally charged content. So they were able to learn how to manage the emotions at the level of the amygdala. When they did their surveys after their intervention, they showed a decrease in depression and anxiety tendencies, and significant reduction in their depression and anxiety scores. So they essentially learned how to manage with better self-control. So instead of the dog walking you, you're walking the dog. So their conclusion was there is less emotional storm with meditation training. So meditation gives you that emotional awareness, the level of the amygdala. So with meditation, they will say, look at, like, observe what you're feeling rather than trying to bury the feelings. Actually look at them. Look at the thoughts, think of the thoughts. And actually during the period of meditation, a physiologic response happens. When they ask you to take those first few deep breaths, that deep breath activates cranial nerve 10 that surrounds the pleural cavity. And it actually slows down your heart. And the activation of cranial nerve 10 puts you into a rest and digest mode. So taking deep breaths. So even if you can't meditate, if you're in a situation where you can't meditate, you can still take big deep breaths. And then that learning stimulates the hippocampus. And then it, again, is tied to these adaptive or behavioral responses at the prefrontal cortex. And this has to be done over and over again to develop a stronger pathway. Now, I came across another interesting study, and I hope someone will write an interesting article about this. This was just one article I read about the power of music. Their hypothesis, classical music helped reduce systolic blood pressure more than silence. And the results showed that it decreased the blood pressure by 8.7 millimeters of mercury rather than listening to silence. Then they did another music study with other students, and they found that salivary cortisol could be measured. So a spike in salivary cortisol noticed after a stressor was prevented if the students listened to relaxing music rather than sitting in silence. And in this study, it wasn't particularly classical music, it was relaxing music of their choice. So music has an interesting effect on the brain. The brain manages music rather differently than general noise. So self-selected and classical music improves stress levels. And objectively, music decreases blood pressure and cortisol levels. And self-selected music can improve endurance, power, and recovery during physical exercise. So a good bonus for using your headphones while exercising. So one person, John Logan, music is the medicine of the mind. So a few slides now to summarize what we talked about. Stress, stress hormones, health effects, and managing stress. Two types of stress, acute and chronic. We couldn't live without either. Both of them are being regulated by this hypothalamic pituitary adrenal axis. On the left side is the acute stressors, releasing epinephrine hormone from the middle of the adrenal glands, allowing you to fight or run. And then the other side with the cortisol release increases blood sugar, which is great if you're starting to have hypoglycemia or low blood sugar. Bad if it's being released from chronic states of worry. So worry is a maladaptive stress response. It leads to prediabetes, hypertension, and heart disease, just to name a few. Remember all of the physiology of what happens in your brain with emotions, the hippocampus, and the prefrontal cortex affecting behavior, empathy for yourself and others, and self-control. So your body is using all these stress responses to survive. Acute stress, threats in the environment, so threats outside, and they activate the sympathetic nervous system. Chronic stress is used to manage body imbalances inside, hypoglycemia, standing up too fast. And chronic stress can also be initiated with worry or perceived threats. And that is a summary of acute and chronic stress, one of my biggest bugaboos myself that I'm challenged with.